How are you?
Thank you.
Thank you for joining. So I just made you a co-host, so you should be able to share when presenting. So that's perfect. Um, I know it's time. We'll give it about 3 to 4 minutes for people to join, and then we'll begin. Have you been out in the field, Dr. Devkota, or are you in Pokhara?
Thank you. Right now I'm in Pokhara, but I was in Seoul for like 2 weeks
Hmm.
together with my good friends from around, and I'm really very happy to see Ali here. Hi, Ali. So we were together during our micro expedition in Langtang area, and it was kind of very wonderful. And now we are here.
Oh, that's great. Hi, Ali.
Yeah, I'm here in suburban Atlanta.
Oh,
I made the trip to Langtang with some other mushroom friends of mine to trek through Langtang Valley to help Dr. Shiva find mushrooms. And he did.
that's amazing.
What was the final count, Shiva? 154?
Thank you. It's about 155, Ali. It was really wonderful trip.
It was a spectacular trip. A little dangerous, very physically demanding, 7 to 10 hours of hiking every day. Uh, and more doll bought than I've ever could imagine.
And we survived, right?
Ellie, are you at Emory?
Uh, no, I'm in private practice
Okay.
in Cumming. I have a solo membership style concierge practice for 20 years.
Awesome. Amazing.
I just like plants and mushrooms for medicine.
Great. All right, for uh, तपाईँहरू सबै जोइन हुनुभएको छ भने प्लिज use this time to save this poison information center phone number that's highlighted here. This is at the new Dulikhial Poison Center. It's available 24/7. So yeah, and you can take this time to also use the QR code to get on our Instagram also, so you can get up-to-date information. All right. I think this is a good cohort to start this webinar today. So namaste and welcome everyone. Welcome to our monthly Nepal Poison Center collaborative webinar on toxicology and toxicology education. We have done nearly 13, 14 of these over the last years. Really great speakers for these webinars, and this gives an opportunity for all of us to learn about the poison center as well, and also learn really important identification and management techniques from worldwide experts on various topics. So because this is mushroom season in Nepal as well, so we thought this would be a really great time to do the mushroom poisoning, and we're also getting some calls about mushroom poisoning. Before we begin, I just want to remind everyone that there is a new poison information center that has been 24/7 service from Dulikhill Hospital. So please save this phone number on your phone and give them a call anytime you get a poisoning case. Even if you know how to manage them, it's really important for us to know what type of poisoning we're getting so we can cater these type of webinars and education sessions based on the need. So the phone number is 011-490-877. It's listed here. You can also use this QR code to follow us on Instagram so that you can get more information. Now, all the past webinars that we have done have been recorded and they are publicly available, so you can watch them anytime. And these are really really great webinars from various experts from around the world. So you can see aluminum phosphide, you can see paraquat, snake identification, lead. So there's a lot of webinars available. Also, please also mute yourself if you can. Anjana, can you mute folks? Thank you.
Sure.
And if you want to join for any research or any other sort of poisoning-based work, if you're interested in joining with our team, please, you can email us at hapsaforall@gmail.com, or you can always message us from our Instagram, and you can join the Poison Center Collaborative. So thank you all for being here. Now, without further delaying, I would like to invite our speakers for today. And I'll do a kind of collaborative introduction here, so I don't come in the middle and do another introduction. So first, we have Dr. Michael Ye. So Dr. Ye is a medical toxicologist, physician, and an adjunct instructor at Emory University School of Medicine. He's affiliated with the Department of Emergency Medicine, where I completed my residency as well. Dr. A is board certified in emergency medicine, internal medicine, and medical toxicology. He has a plethora of experience with mushrooms and, of course, with medical toxicology. So he will be giving our first part of the lecture, talking about the overview of mushroom poisoning. And then following Dr. Michael, we will have Dr. Shiva Devkota. You might remember him. He had given a wonderful presentation last year as well. Dr. Devkota, he's been a mycologist for over 20 years, and he has experience studying wild mushrooms, caterpillar fungus across the Himalayan region. He has a master's degree in botany and anthropology from TU, and he earned his PhD from Switzerland in 2017. He has kind of led efforts in Nepal in preventing mushroom poisoning, as well as mapping underground fungal networks, which sounds like such an interesting and important work. He also, interestingly, has a mushroom named after him because of all his work. We are very, very blessed to have Dr. Shiva Devkota also join us. And his talk, after Dr. Michael's talk, will focus on mushrooms of Nepal and identification, poisonous mushroom, and reducing the risk. So without further delay, I would like to welcome Dr. Michael. You can, I think, share your screen. Let me stop sharing this, and we go from there.
Yes, thank you very much, Dr. Ramu. Thank you for the kind introduction. And I'll just say that when I went into medicine, especially emergency medicine, I never thought I would be involved with mushrooms, although I was very curious as an amateur mushroom enthusiast. I kind of got into this through local mushroom clubs, like the Georgia Mushroom Club, which a Mushroom Club of Georgia, and I'm a member of the group. And I see we have some members of our group who went to Nepal recently. Ellie, also Oscar Sierra, another healthcare provider here in our community. So anyway, it's a real pleasure and honor to be able to speak to you today. So mushroom poisoning is also a very broad topic, and I know that there's only so much that I can squeeze into about 25 minutes or so. It's very humbling to see the biodiversity, the many different types of mushrooms out in the world, and all the toxins and other chemicals, and not just toxins, but also potential medicinal substances and other components inside fungi that are still yet to be discovered. But I would just like to take this time to highlight a few key topics that are important to consider when you're managing mushroom poisonings. So first of all, we can talk a bit about what is a mushroom. Now, I'm sure Dr. Devkota will go into this in a bit more detail. Generally, when we talk about a mushroom, we're talking about the fruiting body of a fungus. And for many fungi, most of the organism is actually not visible. It's not just the mushroom that we see. We often compare the mushroom to a fruit. So if you're picking a mushroom, it's like picking an apple off a tree, whereas the mycelium might be much larger. It's integrated into the soil, the substrate, decaying wood, whatever it is growing on. Also, most fungi around the world are microscopic. The ones that produce mushrooms are just a small subset of the entire kingdom, but you also have molds and yeasts and other types of fungi. And many mushroom exposures here that we see here in the United States are benign. Sometimes little kids might taste a mushroom that they find in the yard. Sometimes it's a gastrointestinal irritant. But unfortunately, as we all know, there are some mushroom ingestions that can cause severe life-threatening illness. And those are the types of ingestions that we are most worried about. I'll go into just briefly some toxicity myths and misconceptions. And as with all other slides here, we can go into deep dives on each one of these topics. But one concept that I think we need to understand is that there are really no generic rules for determining whether a mushroom is poisonous or not. And in different cultures, in different parts of the world, people might have certain beliefs. For example, there are some cultures where people believe that poisonous mushroom will turn a silver utensil black, that it will tarnish. And that really is not a reliable indicator. Some people believe that mushrooms that grow on living trees are okay to eat, but not ones that grow on decaying wood, which again is totally not true. Some people assume that just because you see an animal eating a mushroom, like or an insect, mammal, reptile chomping away at it, that doesn't mean that it's safe for humans to consume as well. Here in the United States, we also have people who migrate here from other parts of the world. We have immigrants who come from all over. And sometimes people will remember a mushroom that they eat back home in their home countries, and they find one that looks similar here in North America without realizing that they might have misidentified it, or it could even be a similar species that might have a different level of toxicity depending on the geographic location. So sometimes people here, we would see patients who would say, oh, but when I was back in my country, we would eat this without realizing that they picked something that was inedible here in North America. For wild mushrooms in particular, cooking is actually very important. Even some edible species can cause illness if they are not properly prepared and cooked. And I will show you an example of that in another slide later on. And so basically, when you're trying to look for mushrooms, proper species identification by someone who has the proper experience and knowledge is truly critical. And many poisonous mushrooms can look similar to edible mushrooms at certain phases during their growth cycle. So sometimes even experts can have difficulty definitively identifying some mushrooms just based on simple gross appearance or a picture that someone sends you. So I would like to just highlight a few groups of mushrooms that are clinically significant to us as healthcare practitioners. So as people who take care of patients, we don't necessarily classify mushrooms based on their biological, their taxonomic classification, but we try to group them by the types of clinical effects that they cause on the human body. So when you hear about a patient who might have consumed an unknown mushroom, one of the first priorities is to make sure that it is not a mushroom that could potentially cause a severe morbidity or a life-threatening illness. And that can be tricky. But one group of mushrooms that we are particularly concerned about are the cyclopeptide-containing mushrooms. So these include many mushrooms in the genus Amanita. So we have, again, here in North America, we have examples like Amanita virosa, the destroying angel, Amanita phalloides, the death cap, and many others. You have also the genus Galerina or Galerina, and these are sometimes confused for honey mushrooms in the genus Armillaria that sometimes people would collect to eat. And these can also contain psychopeptides. And there are also some members of the genus Lepiota that can contain psychopeptides as well. So these are the mushrooms that we're often most worried about that can cause liver injury. So this is a cartoon of representative mushroom in the genus Amanita. And when the mushroom first pops out of the soil, it'll look like this so-called egg. We often call this the egg stage of the Amanita, where it is enclosed in this oblong oval shape. They could look like little puffballs. And when you cut them open, you'll see a little mushroom waiting to pop out. And then once it emerges, you'll see some of these common features of Amanitas. Many of them have, once it pops out of this veil, this universal veil, the remnants will remain. So you have the vulva, which is this area here. It's the remnants of the universal veil at the base of the mushroom. You have the remnants of this partial veil that remains as a ring. And you have scales, which are also remnants of the universal veil that can remain on the cap of the mushroom. Now, sometimes these features might be absent. Sometimes they fall off with time, especially the ring can fall off with time in the rain. So just because one of these features is absent doesn't necessarily exclude the type of mushroom that it might be. So these are some more photos of toxic amanitas found in North America, Amanita virosa and Amanita phalloides. And you can see here the genus Amanita contains a lot of diversity. There are many types. Many of them look white, very large white gilled mushrooms. And you can see for those of us who are not experts at mycology and mushroom identification, they can look very similar. Many of them are very hard to tell apart. And this might not be the best example, but there are certain species of amanitas whose immature egg stage would look similar to puffballs, which are edible. So when people are collecting puffballs to eat, we often suggest that it's usually safest to cut them in half and look inside, make sure that you don't have an amanita egg before you cook your puffball. And these are the honey mushrooms, the mushrooms in the genus Armillaria that can look similar to mushrooms in the genus Galerina. Now, there are several differences. For example, honey mushrooms, Armillaria, tend to emerge in clusters. They grow out of the ground. The spores, if you do a spore print, would be white. They may or may not have a ring on the stipe, the stalk. Whereas the Galerina mushrooms often pop up as individual mushrooms, and they have dark brown spores and gills, and they grow on wood instead of the soil. Although the tricky part is sometimes they can grow out of a piece of wood that's buried inside the soil. So sometimes that is another feature to watch out for. So what do psychopeptides do? So initially, within the first 5 to 24 hours, you might see gastroenteritis. But the key feature, the key clinical feature to look for is the delay. It's delayed severe gastroenteritis with electrolyte losses, and this can be pretty severe. Patients can develop watery diarrhea, nausea, vomiting, and abdominal pain. And this diarrhea has often been compared to cholera in that it is just so severe. But the reason we emphasize the point of the delay is that psychopeptides take some time to cause the clinical effects. And if a patient presents to you with GI symptoms less than 5 hours after eating the mushroom meal, it actually is a reassuring sign. It actually suggests that the person probably did not eat a cyclopeptide containing mushroom. So there are several substances in amanitas that can affect people. There's phalloidin or phallotoxin, and this interrupts actin polymerization. So this interferes with cellular division and many other cellular functions. Now, this phalloidin or phallotoxin has very little oral bioavailability, so it can cause the GI symptoms, but it's not absorbed systemically into the rest of the body. So it's not the phalloidin that typically causes the end organ damage. But then you have other compounds like the amanitins or amatoxins, and these are the substances that can interfere with RNA polymerase II. So you stop protein synthesis, and that can lead to cell death and end organ damage, especially to the liver and the kidneys. So one tricky clinical feature of cyclopeptide poisoning is after the initial bout of gastrointestinal symptoms, sometimes the patient might look better. We call this a quiescent period, where the GI symptoms look better, the patient says they feel better, and it might be tempting to discharge them home. But this is when the hepatic injury is continuing to occur. So it is very important to be vigilant at this stage and not just discharge a patient home after they say they're feeling better, because that could be where all the liver injury is taking place. So in our liver cells, we have this organic anion transporter that facilitates intake of amanitins or amatoxins into the cells where they can cause cellular damage. So if you were to look at the liver tissue of someone who was poisoned by cyclopeptides, you can often see steatosis, accumulation of fat in the liver cells, and you can see necrosis as well as bleeding within the liver. And with these cyclopeptides, it's also important to remember that they are heat stable, so they are not destroyed even if you cook the mushrooms thoroughly. And then for people who have severe poisonings, about 2 to 6 days later, then you can have the fulminant liver failure, and people can die at this point. You can have elevated liver enzymes, such as AST and ALT, and also with the liver injury, you can have hypoglycemia and jaundice and coma, altered mental status. And you can also get toxicity to the pancreas and the kidney as well. So what do we do for treatment for cyclopeptide poisoning? The most important intervention we can do is to hydrate the patients aggressively with IV fluids and to replace any lost electrolytes. That really is a key. And it is thought that we really need to be aggressive with this fluid volume replacement early on before any kidney injury occurs, because once that happens, then that also impairs your ability to clear amatoxins. Sometimes multiple dose activated charcoal may be helpful if the patient is able to tolerate it. Now, this can be tricky, right? Because if someone presents with GI symptoms and they're vomiting, having diarrhea and abdominal pain, it might be difficult to tolerate. But if you're able to get a patient to take activated charcoal every 2 to 4 hours for the first 2 days, that can help cut down on enterohepatic recirculation. So the idea with enterohepatic recirculation is that the cyclopeptide toxins are released into the GI tract through the bile, but then your small intestine will reabsorb some of the bile salts and the cyclopeptides along with it. So it's like a cycle that kind of goes around and around. It just leads to the body retaining the cyclopeptides for a long period of time. So if you can interrupt that process, the idea is that you can probably clear out the toxic substances more quickly. There's also the extract of a plant called the milk thistle. So silymarin is the cruder extract that contains several compounds such as silibinin, silicristin, and silidionin. Now, silibinin has been shown to competitively inhibit that organic anion transporting protein that is responsible for taking up the cyclopeptides into the liver cells. So it is thought that if you can block that, then you can reduce the toxicity. This is still a bit controversial. It's been used more in Europe. Currently in the United States, this IV formulation of silibinin is not FDA approved. And several years ago, we had an open label clinical trial based in West Virginia that was recently ended. And I think, unfortunately, they were not able to recruit enough patients to really even publish anything. But in the United States, at least, silibinin is still available from the Food and Drug Administration. If you really want to use it, you can. There is a mechanism to request the drug. I'm not sure if this is available in Nepal, but again, this is something that is still not very well proven. Some people would give N-acetylcysteine for protecting the liver. Again, with NAC, the evidence is not too great. You can imagine how hard it is to study something like this, right? You really cannot do your traditional double-blinded, placebo-controlled trials when you have sporadic cases of mushroom poisoning. So we often rely a lot on case reports in our toxicology literature. It's also thought that polymyxin B may be something that binds to RNA polymerase II so that it cannot be inactivated by amatoxins. Polymyxin B, if used for a prolonged period of time, can also cause nephrotoxicity, but it is thought that some toxicologists have argued that giving a single dose of polymyxin B at 0.75 milligrams per kilogram might provide a benefit without significantly increasing the risk of causing nephrotoxicity. There are some treatments that are not recommended. So some people have suggested giving penicillin G, multiple suggested mechanisms. It really hasn't been proven as an effective treatment, so it really is not recommended. Also, cimetidine is thought to be an inhibitor for the organic anion transporter, but again, there really is very little evidence that would support its use. So really the idea is to focus mostly on the fluid volume replacement. That is really the top priority. And then if you have access to some of these other treatments, then they might be worth considering. It is thought that hemodialysis may be beneficial for removing the toxin if it is started early. And that can be challenging too, to recognize the type of poisoning and the severity, and also to establish access. And by access, I mean both venous access for doing the dialysis, as well as being at a facility that is capable of performing the dialysis. So that may or may not be realistic. And then, unfortunately, there are some patients who are just so severely poisoned, who have liver failure, and they would require liver transplants as the definitive treatment. There is something called the Santa Cruz Protocol that you might run into. You might hear about this. So this is a physician in California named Todd Mitchell, and he led a clinical trial of psilocybin to treat mushroom poisoning. He came up with a whole protocol of certain steps that is also controversial. It might be worth considering in certain cases, but he emphasizes not only the fluid replacement, but aggressively stopping the enterohepatic circulation by uh, aspirating uh, bile out of the gallbladder. Now, that is an invasive procedure. It is ideally done under ultrasound. So, again, not necessarily practical uh, and also not well proven. But his argument is that you should hydrate the patient very well, keep the patient NPO, give nothing by mouth, use octreotide to seal the sphincter odi so you're not releasing amatoxin into the bile, and then to aspirate the gallbladder to just get rid of as much of that bile that contains amatoxins as possible, and then to give the IV psilocybin. Again, this is not a standard protocol. I'm just giving this as an example of something that one particular physician has suggested that you might hear about. But again, if you have a severely poisoned patient and other treatments are not available, this might be something to consider. So with that, I know our time is limited. We can talk a lot more about psychopeptides, but I do want to highlight a few other things. So in my experience here, I think when people are gathering mushrooms for food, and we're worried about toxicity, sometimes it's useful to ask them, what were you looking for? Or what did you think you picked? So here in the spring, in North America, a lot of people will pick morel mushrooms in the genus Morchella for food. This is considered a choice edible mushroom, meaning that it's not only edible, but it actually is in demand, that a lot of people would want to look for and eat. You also have mushrooms in the genus Gyrometra, often called false morels, because you can see, based on the gross appearance, if you're not too familiar with mushrooms, they can look slightly similar. There are a few key differences. For example, if you cut a morel mushroom in half, they should be hollow on the inside, whereas a Gyrometra mushroom can have a more folded appearance. You might see mushroom tissue on the inside. It's not solid per se, but it won't be completely hollow either. Now, even though we often think of Gyrometra mushrooms as being toxic and inedible, there are some people in some cultures that do prepare and eat certain types of false morels, especially in Scandinavia, Northern Europe, and Eastern Europe. Sometimes these processes involve parboiling, where you boil the mushrooms first, discard the water, and then cook them again. And here in North America, especially around the Great Lakes region, we do have people who trace their ancestry back to Northern Europe. So they have recipes that are passed down with time. And so they know how to prepare them properly for eating to remove the toxin known as gyrometrin. Now, with that being said, I know we typically talked about acute poisoning associated with mushrooms. There's also some really interesting new scientific findings, new epidemiologic studies coming out of France in the French Alps, where there's a significant consumption of false morels and development of amyotrophic lateral sclerosis, ALS, or Lou Gehrig's disease. Again, it's not acute poisoning, but I thought I'd throw that out there, that there is some emerging evidence that long-term consumption of certain mushrooms can also lead to chronic illnesses. So gyrometrin is concerning to us because gyrometrin can be hydrolyzed. It can be broken down into the body to form monomethylhydrazine. So as you may know, hydrazine poisoning is something that is pretty severe. Hydrazine inhibits involving pyridoxal phosphate, and that is very important for the formation of gamma aminobutyric acid, or GABA. You may know GABA serves as an inhibitory neurotransmitter. So if you don't have enough GABA, you can be prone to having seizures. So it is very similar to isoniazid poisoning, for example, and other hydrazine poisoning. So gyrometrin-containing mushrooms can cause liver injury, GI symptoms, as well as neurologic signs and symptoms like nystagmus, ataxia, convulsions. Typically, supportive care is usually all that's needed. You can consider activated charcoal for decontamination. As with other types of seizures, benzodiazepines are the first-line treatments. But specifically for gyrometrin poisoning, you do want to, if someone is having seizures, you want to treat that like an INH or like a hydrazine poisoning. The antidote specifically would be pyridoxine. So you would want to give 70 milligrams per kilogram at a maximum of 5 grams by IV to limit seizures and other neurologic symptoms. I'll just bring this up briefly too. Even species that are considered edible can cause illness if they are not properly cooked. We usually say that wild mushrooms should always be cooked thoroughly, with some exceptions, but as a general rule, most of them should be cooked very thoroughly. So 2 years ago in Montana, one of the states in the Western United States, there was a sushi restaurant that imported morel mushrooms from China that were fresh, and they served them raw or undercooked. They basically marinated the mushrooms in a sweet soy sauce, and they just rolled them into sushi rolls with salmon, and that actually caused 50 people to become sick, and it also caused 2 deaths as well. I won't go into this in more detail right now, but this is just to show that even something that's considered edible, a choice edible, can also cause severe illness if you just don't cook it right. I'll just highlight a few more since I'm running out of time here. There are certain mushrooms that contain muscarine. So muscarine has a very similar structure to acetylcholine, and they bind at peripheral muscarinic receptors. So basically, this can look a bit like a pesticide poisoning. You can get cholinergic symptoms like bradycardia, constricted pupil, salivation, lacrimation, emesis, bronchospasm, and diarrhea. Usually, though, with muscarine-containing mushrooms, supportive care is all that's needed, although you can consider using atropine to reverse symptoms. So there are some mushrooms in the genus Clitosabe, like the Clitosabe deobata. We often give it the common name the sweater, not the type of sweater you wear, but because it causes you to sweat profusely if you eat this mushroom. There are also coprine-containing mushrooms. So here in the United States, we have inky caps, or Coprinus atramentaria, versus shaggy mane, or Coprinus comatus. People eat shaggy manes sometimes, but if you consume a mushroom that contains coprin, you can get a disulfiram-like reaction if you consume alcohol along with it. So disulfiram-like reaction involves flushing and sweating. Very often you have nausea, vomiting, dizziness, headache along with it. The effect can be delayed, so it might take a half hour to 2 hours after eating the meal before you develop symptoms, and also with drinking alcohol. But this can actually last for a long time. This can last for 2 or 3 days. So sometimes if people get better and they consume alcohol again within this time period, they can potentially get the disulfiram-like reaction again. Typically, supportive care is all that's needed. Just give antiemetics, give plenty of fluids, and fomepizole is really not indicated for this. You might be familiar with ibotenic acid and muscimol containing mushrooms. This is the famous fly agaric, Amanita muscaria. And sometimes people in certain cultures use this mushroom for religious ceremonies or consume them intentionally for its hallucinogenic properties. These mushrooms contain ibotenic acid, which act on the NMDA receptor. So it basically creates excitatory effects. So you can have seizures if taken in overdose, you can have myoclonus. But then you can see how similar these structures are on the right side, right? The ibotenic acid has that carboxyl group on the end. So when it's decarboxylate and you cut off that COOH group, you end up with muscimol. And muscimol acts as an agonist at the GABA receptors, where it causes sedative effects, hallucinations, somnolence, and dizziness. There's also the idea that these mushrooms might contain muscarine. And even though muscarine is found in these species, the amount is typically small. It's generally thought that patients typically don't have cholinergic symptoms when you consume one of these mushrooms, that it's really the ibotenic acid and muscimol that cause the predominant clinical effects. Although there have been some more recent lab studies that suggest that the amount of muscarine in these mushrooms might vary a lot. So there might be some, maybe depending on the geographic location or the growing conditions, that might actually contain more muscarine than was previously thought. But in general, the conventional teaching in the tox community is that it's the ibotenic acid and muscimol that are mainly responsible for the effects. And again, treatment is mostly supportive care, treating the symptoms, giving benzodiazepines as needed for seizures or agitated delirium. Now, one other reason I'm bringing up the Amanita muscaria is that sometimes you have edible mushrooms that can look very similar. So the Amanita pantherina on the right here in North America also contains muscimol and ibotenic acid. And sometimes people pick this mushroom on the left, Amanita rubescens, often called the blusher, and that is considered an edible mushroom. And again, just grossly speaking, you can see how similar those mushrooms can look. So that is also a potential source of misidentification. I think I will breeze through this slide quickly. There are some people who pick psilocybin-containing mushrooms to consume intentionally for their hallucinogenic effects. And that's because psilocybin and its metabolite, psilocin, are structurally very similar to serotonin. So symptoms include hallucinations, hyperkinesis, where you have increased activity, ataxia, dizziness, trouble with balance, as well as GI symptoms. And again, typically supportive care is usually all that's needed, along with benzodiazepines as needed. For GI irritants, I would say this probably comprises the majority of mushroom poisonings that we see at our poison center. There are many different mushrooms that can cause GI irritation. And by that, I mean gastroenteritis without organ damage, without the liver damage or kidney damage that you can see with things like cyclopeptides. This is just one example of a foraging misidentification we get a lot here in Georgia. Sometimes people want to pick these parasol mushrooms on the left. The Lepiota or Macrolepiota procera is an example of a mushroom that's edible. But we also have this chlorophyllum molybdites on the right side that looks similar. Now, there are some key differences, and the spore colors are different. which I won't go into all the identification right now, but people do pick the chlorophyllum mushrooms and eat them thinking that they have a lepiota or macrolepiota, and then you get self-limited but very unpleasant GI effects. Same thing with chanterelles. Chanterelles on the left are considered a choice edible type of mushroom in the summer here in Georgia, but then people might pick Amphilotus illudens or other Amphilotus species, commonly called jack-o'-lanterns here on the right. Again, because of the limited time, I won't go into all the identifying features, but you can see just grossly how someone who might not be paying attention or might not be knowledgeable can confuse the two. And the jack-o'-lanterns on the right, the Amphilotus mushrooms, contain something called illudin, that is the gastrointestinal irritant. So again, I'll just limit this to saying that supportive care, antiemetics, IV fluids are usually what's needed. And then, I'm sorry, I'm taking a lot of more time than originally planned here. I want to make sure we leave enough for Dr. Devkota too. I'll just point out that there are also certain mushrooms that can cause delayed oliguric kidney failure. So some of the mushrooms in the genus Cortinarius contain something called orellanine that can cause GI symptoms within the first 3 days after ingestion, but then days to weeks later, you can get interstitial nephritis with damage to the kidney tubules and fibrosis. And so you get the delayed oliguric kidney failure that can occur days to weeks later. There are other mushrooms, I'll skip that one. There are other mushrooms that contain elenic norleucine, which is another compound that can cause delayed oliguric acute kidney failure. So the main point I'd like to make with this is that just because a patient is feeling better after eating the mushroom doesn't mean that they're completely fine. If you suspect that someone might have eaten a Cortinarius mushroom or this one in particular, this is Amanita smithiana, found in the northwestern United States, it's important to counsel the patient that they might need to get their blood drawn a week after discharge from the hospital or to recheck with their primary care doctor just to make sure that there's no worsening kidney failure that's occurring. Here in North America, I bring up this particular example because the matsutake or pine mushrooms found in the Pacific Northwest are considered choice edibles. There are people who pick them professionally to export them to places like Japan and Korea and China, where they are in high demand. But also in the Pacific Northwest of the United States, you have this Amanita smithiana that can look similar. So people have made this mistake before, where they pick a mushroom that can cause delayed kidney failure. And then finally, I'll just mention these two. There are some mushrooms that can cause rhabdomyolysis, so muscle breakdown. These include the Tricholoma equestri, which is considered edible in certain parts of Europe with proper preparation. But it's also been implicated in cases of severe rhabdomyolysis that has resulted in some fatalities as well. In East Asia, in China, Japan, and Taiwan, you have the Russula subnigricans that also causes rhabdomyolysis. So I'll just leave it at that. Wanted to say besides things like liver failure and GI irritation, muscarine, hallucinogenic effects, you also have mushrooms that can cause delayed kidney failure or rhabdomyolysis. Again, as I mentioned at the very beginning, there's a lot more that we could talk about regarding mushroom toxicity, but this is kind of a general overview. Again, to summarize, identification of species is really critical, but it is the clinical signs and symptoms that are most important to guide medical management. Their first priority when you get a mushroom-related call is to determine whether it's a species that's associated with high morbidity, like the amanitas or others containing cyclopeptides. You can consider giving activated charcoal with antiemetics if it's practical to do so. And also, just because someone reports a mushroom-related illness, it might not even be the mushroom itself. Sometimes when the mushroom is not fresh, that can also cause GI symptoms. You also want to consider other ingredients like improper food handling. Could it be food poisoning from something else in the dish besides the mushrooms? Or it can be an infectious cause. It could be maybe pesticides if the mushroom was picked in an area that was sprayed with pesticides. And then finally, with the last few slides I mentioned, patients with symptoms after an unknown ingestion might need follow-up even after they're feeling better to recheck for liver toxicity or nephrotoxicity in the subsequent days. So with that, I think I will stop for now. I'm happy to entertain any questions later if anyone has any, but I would like to then turn this over to Dr. Shiva Devkota for his part of the presentation. Thank you.
Thank you, Dr. Michael. Please, Dr. Shiva, you can go ahead and share the screen. There was a question, maybe Michael, you can quickly, there's a question about how many hours of hospital stay is mandatory. There's a lot of delayed symptoms with mushrooms, as you mentioned. So, maybe you can quickly answer this before we move on.
Right. It's hard to give a specific number of hours that's mandatory. I think, and this might sound a bit like a cop-out, but it really depends on the patient's clinical course. Of course, you want to make sure that the patient is feeling better before letting them go. A lot of this depends also if the GI symptoms started very soon after ingestion, then that suggests that it's probably not a cyclopeptide containing mushroom. So in that case, if they are feeling better, if you're able to get basic labs like electrolytes, BUN, creatinine, and liver enzymes, if all that looks okay, you can consider discharging the patient in, say, 6 to 8 hours if they have adequate follow-up too. You really do want to make sure that the patient is able to be followed closely by a healthcare provider. Now, if that is not possible, I think you really have to tailor your approach to what resources are available in the community. Now, if someone comes in with the delayed GI symptoms and you're really worried about cyclopeptide ingestion, you have that period where the patient can appear to be better, but actually be having the ongoing liver damage happening. So if you suspect a cyclopeptide ingestion, you probably need to admit that patient to the hospital and observe them for a good day or two. So it's very difficult to just provide a set number of hours for all mushroom ingestions because there's just so many different mushrooms out there with different types of signs and symptoms. But I would just say be very careful with ruling out or ruling in cyclopeptide ingestion. I would say that would probably be my first bit of information to help me make that clinical decision.
Yeah, great. Thank you so much. And this is a good leadway to our presentation to identify Nepali mushrooms and seeing, what we need to be considerate. So this is please, Dr. Devkota, welcome. Thank you.
Okay. Thank you, Dr. Carl, for your great opening remarks. And thank you, Dr. V, for your very insightful chemistry of mushroom poisoning and physiology of mushroom poisoning. So good evening and namaste, everyone. So I'm Shiva Devkota, presenting from Pokhara, Nepal. So from last couple of months, I'm engaged with a local organization here in Pokhara that's called Seizure. And now I'm bringing my experience, not like Dr. Ye about the chemistry and physiology, but I'm here to present the real scenario from the field. Because, I'm mushroom taxonomist, so my interest mostly lies on mushroom taxonomy and gene flow and other metagenomics kind of approach. So, and I'm equally interested to link or integrate my scientific knowledge with local people, with the notion that we need to save local people, we need to save a life, So here I am to present some of the very basic things and not the hard science, but very basic things and the realities from the Nepal Himalaya. So with this, okay. So I'll be presenting like a kind of setting of mushrooms in Nepal. And then after I'll be discussing about the diversity, because as we are talking about the mushroom poisoning, we should know the different parts, and their parts must be very visible. So this is the very typical example of mushrooms. And here you see that there are gills and cap, and this is a ring-like structure, and this is steamer type, and this is sac-like structure called vulva, and there are some mycelial threads, and this is gills. So normally what happens is, because whenever people collect mushrooms, they forget, normally they forget to collect this basal part, vulva. And without showing this vulva part, it is very difficult to identify. That's the main reason why I am sharing this picture for your kind attentions. So thinking about the mushrooms, we always think about cap. We always think about the umbrella-like structure. We always think about this vulva or sac-like structure, but the reality is quite different. So for your kind information here, I have shared some of these pictures. Actually, these are from Nepal, and then this is the Palus indusciatus. Here you see this kind of different mushrooms than what we normally used to see, and this is Clathrus argeri. And many people think that this is not a mushroom, interestingly, and this is another Laetiporus sulphureus. It grows on dead stumps, and this is Cordyceps nutans. So we know a caterpillar fungus, we know Yashagomba. So actually, this is not Ersagumba, but it grows, and I mean, yes, let's say grows. Yes, it grows on dead caterpillar. So these are kind of different things than the normal feature of mushrooms. We should know about those kind of structure. Not only that, and then because my presentation is totally focused on Nepalese perspectives, we should know about the number of mushrooms in Nepal. Then so far we came with a figure like we have 1,291 species reported so far from different parts of Nepal. And this is our 2020 publications, and this is kind of very new information, updated data. And for your kind of information, there are only about 14,000 mushroom species are reported in the global. So the species which we have in Nepal, just 1291, is kind of very inadequate. So we need to explore many areas, and that's the main reason why this 1291 is very less figure, I guess so. So here are a couple of other mushrooms maybe you have seen or might be new for you all, but this is kind of Corbinellus glaucosus. It is kind of very funnel-like mushrooms, which I capture in Kanchenjunga, no, in Manaslu area. And this is Torbidomyces clapi. This is very common mushroom in Nepal, and it is highly edible mushrooms. And I found this mushroom in Taplejung districts nearby Phungling district headquarters. And this mushroom, this is Ophiuchorus sinensis. This caterpillar fungus from western part of Nepal in Dolpo. And this is another Amanita langostrata. This is a kind of poisonous mushrooms which we found in Palpa, above Palpa Bazaar, that is the Srinagar forest. And here is another Shulis sibiricus. This is edible mushrooms from Khumbu, from Everest region. So so far, this is kind of very interesting figure, because so far only 159 species have been reported as edible or for their culinary value, and while there are 25 medicinal and about 100 species are toxic. So about the toxicity, as Dr. A said, that there are different kind of chemotypes, right? There are different kind of chemotypes, and not all mushrooms are really or deadly toxic. There are a couple of mushrooms which are deadly toxic. There are a couple of mushrooms which only bring kind of discomfort. So I will be describing those mushrooms in that case. So whatever the case is, this is interesting to know that as we are talking about the mushroom poisoning cases, we should know actually the what would be the hot spots and then what would be the hot spot in Nepal. So I would say that this is our publications which we made in 2008 based on our 16th month works in different middles and lower plains in Nepal. And we found that most of the edible mushrooms are in temperate coniferous forests, that is 2,500 to 3,000 meter altitude. And the Tamang community, Tamang people, literally they collect and they eat lots and lots of mushrooms. So we found 56 different species. So this also shows that the kind of correlations, because most of the mushroom poisoning cases we recorded are from this altitude, 2,500 to 3,000 meter altitude. And most of the victims are these Tamangs, Magar, Gurungs, Dalit, and these are because these are the mycophilic communities, mushroom lover communities. So when we launch our program, when we study further in-depth research or whatever, we need to focus on this kind of variables like where should we go and what would be the targeted ethnic groups. So just to let you know that we are compiling, we are reviewing, we are making a kind of systematic review of mushroom poisoning cases in Nepal for the last 20 years, bringing all this data from newspapers and central police stations and local authorities. So we are compiling our data, and maybe next year, within next 10 to 12 months or so, we'll bring our publications with the systemic review. Then it will be more easier to show that okay, these are the mushroom poisoning prone districts, these are mushroom poisoning prone communities, and these are the mushrooms and pushable mushrooms. So we are working on that because we don't have such data so far, very organized data so far in Nepal, and not so sophisticated publications have been made on mushroom poisoning. But this kind of figure literally gives about the ethnicity, gender, and local tradition about mushroom poisoning. So, being said that, so as we are talking about the mushroom poisoning, so mushroom poisoning is the one part, but overall, if we look at the broad spectrum, mushrooms are really good thing. So because they are really important to contribute different SDGs target, that is Sustainable Development Goals targets. So like zero hunger and for good health or quality education with the fungus money, and economic growth, responsible consumption and production, climate actions, and life online. So there are a couple of benefits. And only some of the mushrooms are really getting very problematic. So let's talk about the morphological diversity of mushrooms, as I have already highlighted some of the pictures. So when we deal with mushroom poisoning, when we make people about the mushrooms edibility, and when we try to give them knowledge about mushrooms, people they must know about the different forms of mushrooms, so that there will not be confusion. Like because there are several types of mushrooms. We have 1,291 species, and there are different forms. There are different morphological variations, and with such variations, people always used to get confused. Okay, this is this, and it looks similar to this. So uh, for the proper mushroom identifications, there are several parameters to look after. That's why it is really very difficult to identify going through pictures, because we used to call them that phototaxonomy. We literally need to work at our lab for the identifications. We literally need to look under microscope, and if not, we need to run barcoding. and some genomic analysis. But going through the morphological features, it's very difficult to identify the mushrooms. But there are a couple of things that we could apply and to identify, like whether the cap is convex or hemispherical or spherical or ovoid or conical, cylindrical. These are some features to identify edible and poison mushrooms. And apart from that, the gills arrangement, because not all gills, the lower part of the mushroom's cap, that's the gills. Gills attachment or arrangement is very important feature, like whether that is attached to the stipe, whether that is free or slightly attached or nosed or decurrent. So these are the common features to look after for the proper identifications of wild mushrooms. So with this, here I would like to share a very beautiful canvas, I would say, because there are a couple of interesting mushrooms, and all mushrooms were captured by me myself. So here are a couple of mushrooms from eastern part to western part of Nepal, from lower plain to high altitude, and to make people aware about the mushroom poisoning, we should give them the details of mushrooms. Okay, what would be the mushrooms, how many morphological forms we could expect from the forest, so blah blah. So these are the common mushrooms found in Nepal, and not all mushrooms are poisonous. There are only a handful of mushrooms, and they are really poisonous and are really dangerous. So I'm not describing in detail. And just to making my story, like because I used to get several mushrooms images on my email or social platforms. It's really very difficult to identify all mushrooms with phototaxonomy, as I share with you. So I urge people who really want to share pictures, not only the morphological features like this, not only the gills arrangement, not only the teeth arrangement, not only this kind of pumpkin mushroom, not only this kind of color changing mushrooms, but other things to know is whether mushrooms bear some milk or latex. This is also another very important identification character for the mushrooms, and whether the color changes or not. So here you see these mushrooms, and when I make a browsing or when I make a kind of scare, then the color changes because of this oxidation process. So this is also very important trait to identify the mushrooms. So if there is mushrooms like a latex bearing, that is Lactarius species, and if not, then it might be Rosula or other species. So this is really very important to look. And apart from that, the size matters, because some mushrooms are really good in their size, and some look like cauliflower, and then some are very tiny. And in some mushrooms, the color might change because of the oxidations, and these kind of things are really important for mushroom identification. So better to capture every information while collecting mushrooms or while taking mushroom pictures, and or whenever you need to treat any patients, better to ask to get detailed information of mushrooms, if possible, if possible. So whether that mushrooms grows on dawn or swell, or that's a singular or in the gray areas, either grows in this alone or in the cluster, tight clusters, and what is the lower part of the gills, what color and the size. So such features are really important to identify whether edible mushrooms or poisonous mushrooms. So with this, I'd like to jump into mushroom poisoning cases, as I'm sharing lots of information from Nepal, from not only from scientific parts of view, from social point of view. Here are some of these very serious issues from Nepal in the last couple of years. So may I request you to go through like five members, 14 mushrooms, wild mushrooms kill 14, 5 of a single family, 10 taken ill after consuming poisonous mushroom. And here is another mass poisoning case, 15 people, 6 die after consuming wild mushrooms, 3 die after consuming poisonous mushrooms, 2 dead to taken ill by consuming wild mushrooms, And this is just recent one, right? July 23. So why I'm sharing those all news clips is like because normally mushroom poisoning cases occur in Nepal in a collective way. Let's look after our culture, because people think that mushroom is very precious because it grows only during June, July, August, and September. And people also think that the wood which they find growing mushrooms is like their very private property. They do not want to disclose that area or that stumps, so they collect mushrooms by themselves. And this is kind of very good item. They want to share that with their neighbors, with their relatives, and with their family members. And sometimes, mistakenly, when they collect poisonous mushrooms together with other edible mushrooms, then they not only divide the edible mushrooms, they also divide poisonous mushrooms, and such kind of mass poisoning occurs. So this is really very serious issue. So what we need to do is we need to educate them. Okay, please do not collect any doubtful species. Number one. Number two, if you are, please do not trust on others, right? Because never trust on others. Relatives trust on others, and such kind of 15 people ill and 14 killed. Such news appear. So these are some of the things need to be considered to make people aware about mushroom poisoning. And I'd like to share some of these issues from Nepal. So far, we don't have many publications on mushroom poisoning, sadly, from Nepal. So when I go through literature, when I try to find several literatures, I found this literature really very important, and this is from China. And while going through the literature from Nepal, I found that there are several similarities, because most of the cases are associated with acute liver failure. And as Dr. is say, there are several other symptoms, as you can see here. So acute liver failure is very common in China and also in Nepal. So having the fatality rate is about 11%. So with this, I would like to bring some of these tragedies from Nepal. So because I'm not from medical background, I'm from the mycology. I'm from the taxonomy. I'm here to identify mushrooms. So better when you treat your patients, so better you get ideas about the mushrooms morphology, and better you get ideas on how to get good pictures. Better to have ideas on what to ask to the patients, or what to ask to the victims if they could collect mushrooms, how to get mushrooms images, how to get mushroom samples. Such information is really very important to overcome mushroom tragedies. So here I would like to go back to take back to 2005 tragedy, because still it is considered as a very tragic incident in Nepal, because in Palpa districts there were 12 people who died and about 44 people were hospitalized. And then we came to know about that news, and then next day we went there. We met some people there. We met doctors, medical officers at Palpa Mission hospitals, and we asked some of these victims, who could really walk to move together to the forest, and we found that there are a couple of mushrooms growing nearby, like Amanita phalloides and Amanita longistratum. So later on, we gave such information to medical officers, and they treated them because this is amatoxins and highly poisonous mushrooms. So this is the way how we identify mushrooms. And is I have a kind of passion to work on mushrooms, and I'm also very, tossed, let's say, very tossed, and I have a great passion to help people who get mushroom poisoning. So I always used to be there whenever I can find my time, and then I always used to visit such places. So there is another place from Lothar, Chittagong, where 8 people from a single family. This is very, very tragic accident. So 8 people from a single family died after consuming poisonous mushrooms. Though we could not find that mushrooms because we were late. But I believe that that is also Amanita pellets mushrooms. So these are some another case, and another case is from Pokhara, just nearby my home. So what happened is that 8, including children and elderly, fell ill from consuming poisonous mushrooms. So I went there, and next day I went there and then explored the forest and came to know about these Amanita mushrooms. That this is my finding from that area, and I used to educate them how to identify, how to avoid, and what to do, and what to um, avoid. So these are the some practices that I'm doing. Have been doing, since last couple of years. So with this, why such tragedies are happening in Nepal every year? Why about 30 people losing their life every year? So as I try to find answers, I came to know that misconception, misguided, misbelief, and because some people they think that mushroom growing on live trees are edible, and they collect everything, but there grows on pilatus species, and that is poisonous. And something that mushrooms growing on decaying straw manure are poisonous, but there are some edible and some poisonous mushrooms. Something that people think that mushroom growing on wood and mushroom growing on soil, they have different characters, and they think that bright color mushrooms are poisonous or we do not eat, but that's good in many senses. But there are a couple of mushrooms which are edible and people used to eat, but they get confused with Amanita pantherina. And people believe that the mushroom with the rocks or warty cap, texture are poisonous, and that is good in many cases. But there are a couple of mushrooms they used to collect for their because of their edibility. But in the meantime, they get confused with another similar looking mushrooms. And people still believe that the flesh changed after tossing and brushing are said to be poisonous. But there are certain mushrooms they are edible, and people used to collect, but problem appears there. So here are a couple of mushrooms which are really poisonous. If you look thoroughly, this is Amanita citrina, this is Amanita longistrata from palpa, this is pantherina, this is phalloides, this is Folsinia, and this is Calaboltus panniformis. So these are the poisonous mushrooms, and the case in Chittagong and in lower plains are mostly related with this kind of Amanita birosa and Amanita citrina mushrooms, because if we look after this Amanita chepangiana, it is edible mushroom. This is highly edible mushrooms, and chepangiana means from Chepang community. So this is also kind of endemic mushroom. So Chepang community, they used to collect this mushroom. This is really very good edible mushroom. But in the meantime, there are similar looking mushrooms, Amanita birosa and Amanita citrina, and the people used to get confused with these mushrooms and they get poisoned. So this is the case of why such happen. And another thing is like, maybe you know that mostly the people who move from workers, let's say workers who move from eastern part of Nepal to western part of Nepal, let's say people from Ilan reach to Bardia or Banki just to work. And they think that this mushroom is edible because they used to eat those mushrooms in their area, in Ilam area, and they think that this is exactly the same mushrooms, and they get confusion. They used to get confused, and poisoning happens. So there are several factors to trigger mushroom poisoning in Nepal. So this is a very good example, or very sad example, whatever, from Chittagong, that Chepang's community, they used to get confused with Chepangiana, with Birosa and Citrina, both are poisonous mushrooms. So to overcome such tragedies, in last couple of years, we did not have materials to share with the local communities, and then I tried my best with other partners and supporting hands with other organizations, and then and brought this produced these posters with possible poisonous mushrooms in Nepal, because as I said, still we need to explore several areas, and there might be several other poisonous mushrooms, but as far as I understand. So these are the couple of mushrooms which are highly poisonous in Nepal. So Bacillus involutus, this really looks like other mushrooms and phyloids, and so we have produced those posters at about like 4,000 plus posters, and we have distributed across several areas in Nepal. And last year we have also produced posters in Nepali together with Department of Forest. So thanks to Department of Forest for this great initiation. And then I have provided a couple of my pictures and prepare a note to share. And this is in Nepali, and we have included Mycina pura is a new mushrooms here, and Galerina marginata, some mushrooms. So these are the posters available in Nepal to make people aware. And then if you look very carefully on those mushrooms, their textures, their these annulus arrangements, vulva arrangements, and it gives very good idea about the poisonous mushrooms, and at least people will not eat those mushrooms, or at least they will take care, they will be very aware in selecting mushrooms. So amatoxins, I'm not going in details about the chemistry and in details about the physiology of mushroom poisoning, as Dr. Ye already kindly describe about that. So I'm just skipping this because this is Amanita phalloides, and this is Bacillus involutus, and this is Cortinarius species, all from Nepal. So what are the measures? What measures are needed now? So to overcome mushroom poisoning, it is I would say, and I would request, it is a collaborative effort. It must be very collaborative effort, because it is not only about the plant mycologists, not about the mushroom taxonomy, it's not only the medical offices, but the government, local bodies, and local communities. We need to bring our very collective approach. So whenever I get chance to distribute my posters, whenever I get a chance to interact with local communities, and whenever I get chance to speak with the mothers group and the children and the people out there, I always used to carry my posters and distribute them, so that they will be aware. So this is the way how we make people aware. And I really appreciate and thanks because now we have also mushroom this poison information center in Nepal. It's very new, and I really appreciate that, because as I spent a couple of years in Switzerland, there are a couple of areas where we could find mushroom inspector just nearby the several places. So I hope one day we will have several mushroom inspectors and they could identify our collections and mushrooms, but we need to bring our collective approach. So at least having mushroom, this poison information center is also very important, so that people can ask or at least be aware. So what we could say is what we could say is it's very difficult to say or inform that which mushroom to eat, which mushroom to consume. So, but it's very easy to say which mushroom to avoid. So I always used to say, please do not eat any unknown mushrooms. And regarding the collective approach, like as I have seen many medical officers here, and thank you for your very interest, because uh, we need to train primary care physicians to recognize amatoxin poisoning and provide appropriate treatment, because most of the cases, because the cases happen in rural settings. And mushroom poisonings is kind of early symptoms and the late symptoms. So some symptoms might appear after 48 hours of consumption. and it will be too late for them to visit the district district hospitals. Okay, so it is really very important to train primary care physicians in remote areas, and then regarding these basic features of mushroom poisoning, and then immediate medical attention for symptoms like vomiting and diarrhea after consuming wild mushrooms. So we need to train we need to aware local people, and then so the important thing is we need to make people aware, and we need more research. We need outreach like this, and then we need we need very collaboration. So now we need to, like, now the mushroom taxonomist and mushroom and medical officers and the government, we should collaborate together to bring some approach. Like what we did in last year is like because there was mushroom outbreak in Manang, mushroom poisoning outbreak in Manang, and Dr. Adhikari from Manang, and then other doctors from around, like Dr. Sharma and Dr. Gimire, So we have collaboration, and I identified the mushrooms, and I helped to identify the mushrooms, and then they bring their medical knowledge, and then this is the kind of publications that we are bringing sooner. So this is how we overcome mushroom poisoning in Nepal. So with this, not only that, now we have also started making people aware about the poisonous mushrooms. So this is from Dolakha districts and the Gauri Shankar Conservation Area. There, the conservation office has started fixing hoarding boards in the trekking route to Choralpa Lake. So this is the way how we are trying to make people aware, and we are trying to save lives in remote areas of Nepal. So with this, I'd like to thank you all for your gracious presence, and thank you for this wonderful opportunity. Thank you very much.
Thank you, Dr. Devkota. That was really fantastic to add more context to the presentation that Dr. Michael Ye started. So this is really great. There are a few questions that maybe we can take a few minutes to answer this. So first we have from Ellie. She says, how does the outreach effort accommodate for low literacy and language differences across Nepal? Maybe Dr. Devkota, you can answer this.
Sorry, I lost my connection. Would you mind please
Oh,
repeat?
yeah, sorry. The question was, how does the outreach efforts, how do you sort of make up for the language differences across Nepal, and maybe the literacy level being different as well, between folks?
Okay. Thank you, Dr. Campbell, for your great query, because you were in Nepal and you know very well about the education level of people out there, and their literacy or their different dialects and language. So far, in my very personal experience, whenever I go to remote areas, I always used to collaborate with local people, and sometimes I need to get local translator, and the local elderly people, they are really very helpful to communicate with me, and they used to transfer their knowledge, and also they used to share their knowledge with the young generations. So yeah, that's the way we overcome such problems.
Yeah, and no, thank you so much. I had I had a quick question. I guess this is to first to Dr. Michael Ye. With that protocol, the Santa Cruz protocol that you mentioned, I saw that it's been done in dogs. Has it been done in humans also? And that's why this doctor is recommending it. I couldn't find any case reports on humans, but I also haven't looked in that detail.
Right. Yes. And I think that's one reason why it's still considered controversial that he is proposing an invasive intervention in addition to the IV fluid hydration, and also the use of octreotide is also not something that's a
Right.
well-established intervention in addition to the psilocybin as well. I believe he had encountered multiple patients that he treated himself, and I believe that's how he developed this protocol. But again, it's very challenging in medical toxicology in that, as I mentioned before, we are not able to perform uh, blinded, controlled clinical trials on many of the uh, conditions that we treat and manage. So unfortunately, we are limited to these case reports to guide our clinical decision making in many cases.
Right. Um, Dr. Shiva, the sort of the cases from Palpa that you mentioned a while back. I mean, was there anything done sort of public health? Did something change after that in Nepal, or is that when, a lot of sort of advocacy stuff started happening?
Yeah, thank you, thank you. So interestingly, once we found that Amanita longistrata and Amanita faloides mushroom growing right nearby the hospital, okay, just above the Palpa Mission Hospital in Srinagar forest, and then we collected that mushrooms and we demonstrated that mushrooms, and then we made people aware. Like we reached out to the local journalists, and then at that time FM stations were really very popular, and we reached out to FM radio stations, and that news was also published on Kantipur newspaper and Himal newspaper by then. So later on, people really, yes, people were aware, and we also prepared some awareness materials and given to the medical officers at Palpa Mission hospitals. And even, the flashback is like even last year, I was there, and I gave several couple of posters here, and many posters are still there. So Palpa is kind of very mushroom poisoning prone district, very hot spot, and then such cases are happening every year, but but the places are different, locations are different. So
Right.
yeah, people are aware, quite aware there, and we don't have such mass tragedies so far here.
Right. Yeah, that
Yeah.
was a tragic case there. Then I think we have time for one last question from Dr. I think this is Dhiraj Khati. The question is, can we be sure that commercially produced mushrooms are safe, and is there chances of poisonous mushroom being infested to edible ones? I guess either of you can, or both of you can answer that question.
So I think should I give very little?
Oh yeah,
Yeah.
please.
As far as thank you, Dr. Kati. As far as concern, as far as I understand, um, commercially produced mushrooms are very safe to eat. Okay, very safe to eat in compare with wild mushrooms. But sometimes, not because of the mushroom poisoning, not because of the amatoxins, not because of other kind of toxins, but only because how they handle harvested mushrooms. Like the post-harvesting can bring some changes, like because of bacterial infections and other kind of things. Otherwise, commercially produced mushrooms are very safe, very, very safe to eat. And I would recommend for that. Unless or until you have very good idea on identifying wild mushrooms. Commercially produced mushrooms are very good to eat, and they're really very safe.
Awesome. All right. Any other last thoughts, Dr. Ye or Dr. Devkota, before we close this?
I think it's really nice to be here, and then this is a kind of very good dialogue, I would say, because as I always share that mushroom research, wild mushroom research is very new, and we have started from very scratch. So whatever is going on is really good. And then now there is someone to pick their phone call and listen, okay, what kind of mushrooms and blah blah, So this is already a great starting. This is really a great starting. Now people can. Now I'm also getting several calls. I have also several mushroom species from around the Nepal, and then it's a way how we collaborate. Maybe next year, or maybe we can roll together to bring on very good project proposal, bringing scientific and social knowledge and medical knowledge together and make people more aware. So our goal is to make people aware and make them alive. So this is really a great initiation. I really appreciate.
Thank you.
Thank you for the invitation. I'll just say that you're poised to do very important, wonderful work, and that really the key is prevention, preventing people from getting sick in the first place,
Yeah.
in addition to building the capacity to treat people. But if you can prevent people from even getting exposed to poisonous mushrooms and increasing education in the communities where people forage for mushrooms, that would really save a lot of lives.
Yeah. Well, thank you both. With this, we'll bring our session to close today. First of all, I would like to thank really all of you who have joined here, given your evening, and to learn, this important topic during an important season. So thank you to all the participants. I know you're joining from various parts of Nepal and maybe some from outside as well. So really, we really appreciate it. I would also like to thank Dr. Michael Ye, giving us this time, his expertise, knowledge. We learned quite a bit. I was fascinated about a few things there, so I'm going to look into this biliary drainage stuff, which sounds very exciting. So a lot of thoughts that he has given us, and we'll have his slide and presentation on our YouTube shortly. And thanks to, of course, Dr. Shiva Devkota, who has been, he has joined with us from last year. He's one of our experts. If we get a poisoning case, if you send us a picture, we send it to him to help us identify. So, please don't hesitate if you have any cases that come across your clinic, your health post, your hospital. You can always reach out to the, here, Dhuli Hill Poison Information Center. I put the phone number down here, and you can send us picture through Viber, WhatsApp, and we'll get our experts like Dr. Devkota. So we learned quite a bit from Dr. Devkota's presentation, and his experience is really valuable for our country. So we are very appreciative of you as well. So thank you both. I would also like to thank our Dhuli Hill Poison Center partners who are probably here. I've already shared the phone number. And I would like to thank Nepal Poison Collaborative and HAPSA Nepal, which is the organization this is all running under. So you can always stay connected with us through our website, email, which I have listed here, as well as our Instagram page, which is easier to connect with, and feel free to email us. So I think with that being said, we will close this session, and thank you so much. We'll send you the YouTube link for this tomorrow. All right. Namaste, everyone.
Bye.
Yeah.
Bye.